early on, I had an experience with my beloved cousin who was an uncle that was not a lot older than I was. He developed tuberculosis and ultimately died of tuberculosis, and he was sort of my hero, and I had that memory.
Joe Bates arrived at medical school at the University of Arkansas in 1950, where he'd also complete his residency, internship, and fellowship in infectious diseases. During this time, he earned a reputation as an earnest student and an even more dedicated researcher.
I was the subject in some of these, and they were interested in looking at the pressure inside the chest as you breathe. And you, of course, couldn't stick a needle inside through the skin. And it turns out the pressure in the esophagus reflects accurately the pressure in the pleural space in the chest. And so they had a condom, actually, and it was attached to a tube. And on Saturdays, I would swallow this condom, and they would position it down into my esophagus, inflate it like a balloon, and hook it up to a transducer and measure the pressure as I took deep breaths, shallow breaths, all sorts of things.
Bates earned the nickname Mad Dog Bates for his ironclad insistence on excellence and exactitude from his students and subordinates.
So I first met Joe Bates probably in 1975 or 1976, and I was fortunate enough to be randomly assigned to his service on the medicine service at the VA as a junior medical student. And my colleagues all looked at me when I was assigned that, and they said, well, this is really unfortunate. And I said, well, why? And they said, well, you know that his nickname is Mad Dog Bates. And I said, what's that about? And he said, well, he chews up medical students and residents. But Joe was a really wonderful mentor as a medical student and became my lifelong professional mentor.
Despite his hard-charging demeanor, Bates was an inspirational champion for his students and worked tirelessly to bring noted physicians, researchers, and educators to Arkansas.
And Joe was a fearless recruiter. He was constantly recruiting. He kind of punched me in the chest, said, you be sure and come back. Well, I wasn't up there 3 months before Joe Bates was calling me to come back to Arkansas when I finished my fellowship. And he stayed after me. People from my department of psychiatry never called, never followed up, never said, come on back. And Joe stayed on the phone, would call me about every month. Wanted to get a deal done. So I came back, and psychiatry at the time wasn't very interested. And very uncharacteristically, I worked for Joe Bates for 3 days out of the 5 days a week.
Dr. Bates is internationally renowned for his study of tuberculosis, a rise that began one night in the emergency room.
It was probably a very transforming experience for me. It was when I was a resident. This young boy was 14 years old. I remember him well. He came in coughing up blood. The nurse there brought him in, and it turned out we diagnosed tuberculosis in him that very day. And when I found out that he was in this, they called it the Boys Industrial School, I got very interested in transmission. And there were a lot of new data at the time doing guinea pigs that the tuberculosis was transmitted very differently than had traditionally been thought.
Studying the boys' living conditions and fellow inmates, Bates proved recent animal findings that the disease might be spread through airborne particles, not direct contact.
They slept in permanently assigned bunk beds, one on top of the other, and there were about 150 boys altogether in that room. And they had had tuberculosis there before, so they had baseline measurements about tuberculosis on every boy that was admitted with tuberculosis skin tests. And so I had that baseline data. And so all of a sudden I saw this is what they had done at Hopkins with guinea pigs. Here I had an experiment of nature almost in humans. And I did a lot of studies to show that it was this tiny particle that caused the transmission.
Bates's controversial findings were published in the New England Journal of Medicine, whereby he and his team demonstrated tuberculosis patients, with proper treatment, were non-communicable after 2 weeks instead of months or years in a sanatorium, which was standard at the time. In so doing, he revolutionized diagnosis and treatment of the dreaded disease.
And the particle is very subjected to antibiotics, so it's very susceptible to treatment, so that you can eradicate these little tiny particles as far as their infectiousness is concerned in 2 weeks of treatment. And this just revolutionized the way sanatorium life became.
Dr. Bates joined the Arkansas Department of Health as director of the Tuberculosis Control Program and served as Deputy State Health Officer since 1995. He was a driving force in the formation of the Arkansas Center for Health Improvement and played a key role in the establishment of the College of Public Health.
One thing I'm very proud of at the health department is that we've collected together a group of highly trained, highly competent professionals in public health that we didn't have before. And that's had a big, big impact all through the state in many ways in public health.
So Dr. Bates was at the table at the very beginning of the conversations about ACI. Those were formative years because that was the period of time that we were able to begin to articulate a vision for something that could advance public health in the state. Additionally, he was very clear in a vision to create the Center for Health Improvement. He worked diligently to bring the right people to the table, to encourage statewide presence, to encourage a direct involvement with the legislature, not only the legislature, but the governor's office and the judicial branch. So we were trying to create a presence in the state, and he was formidable in making that happen.
Dr. Bates provided critical leadership for the Clean Indoor Air Act of 2006, which protects Arkansans from secondhand smoke, and was the leading advocate for fluoridation of Arkansas's water in the interest of oral health. There was no barrier too steep when it came to affecting health policy or advocating for the needs of the marginalized.
Joe was a champion for the underdog and the underprivileged. He really felt strongly and has a deep commitment to equality of health and health care and throws himself completely into that. Whether it was for African Americans before our healthcare system was integrated, whether it was for the Hispanics that have come over the years and may not have a legal residency, or most recently the Marshallese in northwest Arkansas, whose islands we bombed with nuclear bombs in testing of World War II, and they live in northwest Arkansas but are not U.S. citizens. So this commitment to achieving equal care and good care for all has been a lifelong commitment that I've watched and observed in Joe.
So in many ways, it's so fitting that Dr. Bates be given this inaugural award, the Tom Bruce Award. He and Tom were lockstep in their mission to create a better and healthier Arkansas.